back to the Your Life, Your Way community. I'm your host, Kathleen McDermott. Your life, your way. Feeling safe, being you, guilt-free. Living life on your terms, no longer living how the rest of the world thinks that you should, no longer being and doing how the rest of the world thinks that you should. Gives you the freedom to build a new and powerful legacy for yourself and your children if you have them. And speaking of children, we are diving into a topic that is actually going to be a two-parter. It was so fascinating to me that I said we have to come back and talk more. How much do we really talk about pregnancy and childbirth? You know, we celebrate, we support others, but what is beyond the joy? What is sometimes happening beyond the joy? I wanted to bring this topic to the forefront because I had never heard of it. In all my years, never heard of it. And of course, my feeling was women are going through this and they're not talking about it. They're feeling alone, they're suffering, and they're not talking about it. Now, some, yes, some are. But I guarantee there are many that are not. And my whole point is I do not want women to feel alone. I want this topic to be brought to the forefront. And if I can help as many women as possible to know that they are not alone and to seek help and to seek support, let's do that through these two episodes. I have a wonderful guest, and she's going to share her experience. Stephanie Thompson is the creator and founder of Bravemumma. Before Bravemumma, she was a teacher, a triathlete, and a small business owner. What is she doing now? All that has changed, but why? Stephanie is also an author, and the book title is what we're talking about in these two episodes. The title of her book is The Day My Vagina Broke. This is a very, very important topic. Let's dive in. Thank you so much for joining us. Stephanie, welcome. I'm so excited and honored to have you here with me today and all of our listeners.
I am so honored to be here with you. Thank you for having me.
Oh, my pleasure. And I'm kind of also curious a little bit about your past. I mean, yes, you've been a teacher and small business owner, but you've also been a triathlete.
Yes,
I found that to be
later
very
in
interesting.
life.
Yeah.
Yeah, later in life, which is quite funny because in my early 20s, I wouldn't even consider myself to ever enjoy exercise. And then a life event happens, and then all of a sudden you pivot and change. And for me, I went through a cancer treatment for a year. And at the end of it, all I could picture was myself like running out of the hospital ward and never looking back. And I think that's where I wanted to start running. But at that same time, I was like, well, I could get really bored quickly with that. What else could I do? And okay, I could cycle and swim at the same time. And then that kind of kept my interest. But it was just that life is too short. You now need to go and live every single day like it's your last. And triathlon just kind of fitted very nicely in there.
That's quite, I find it so fascinating because I don't know if, of course, we never know, but I don't know if anything could ever make me pick that.
Yeah.
So it's interesting to hear when someone finds that that's their path. I mean, I thought it was great when I just started cycling. You know, that to me was a lot.
It is.
So kudos to you. And of course you had, and I'm not downplaying it all, you had a very special and unique purpose getting out of the hospital and really finding your new path. So wonderful.
And I'm really grateful for it. I know that sounds funny to some people, like, what? You're thankful for cancer?
You hear
I
that
really,
though. You hear, all the time you hear that.
It's true.
Our greatest lessons, I've often asked, you know, Mother Universe, why does it have to be our hardest turmoils that hold the greatest lessons?
Agreed. I think I know the answer for that for me, if you don't mind me sharing.
No, please.
because the lessons I was being sent prior to getting sick, I wasn't listening. I felt like I was getting nice little taps on the shoulder to calm down, settle down, stop being so like stressed in my career as an early teacher, and stop working so hard. It doesn't mean by working hard you're actually getting any better. It just meant that you were getting more stressed. And I wasn't listening. I just kept pushing through. I just kept thinking, well, if I just work that little bit harder, I'll get to here. And then when you got to there, and then you go to the next level, and then like there was just never any stopping.
Hmm.
And I think cancer made you go, whoa,
The
you didn't
2x4.
listen.
That was
Yeah.
the 2x4 that finally up to the side of the head. Yeah.
You're now stopping, if you like it or not. So I think they are hard, but that's because we're not attuned. Well, we never taught how to be fair.
True.
Never taught how to listen and to be aware. 20 years on now in my 40s, I'm like, oh, that's what it was. Retrospect is really easy to look back and say, okay, I got it.
Could have listened. Of course, now I find, do you find that after having been through and not listening to the signs, now you're really in tune to listening to the signs or paying attention?
I think I got a few more lessons first.
Uh,
Now, yes. A few more hard lessons in between that it's taken a lot. I wasn't a good listener, clearly, because I keep
I can
getting.
so relate. I can so relate. Little stubborn here.
Same. I get it now. I listen now, and it's a very new thing. So it's still adjusting, still
practice.
Yes, I love that. It is a practice that you need to continue to get better rather than think, I need to just get it right now. Letting go.
Yeah.
It's really, really hard.
It is. We are so conditioned. I'm just going to flip this on because I feel like I'm looking at myself in the darkness.
Okay.
There. We're so conditioned to just keep that pace, that forward motion, and worry about things that just, my mother used to always say to me, well, she's still here, so she still says it. But as I was going through each generation, 10 years, going up to high school and then being in my 20s and 30s, she would always say, with every 10 years, you're going to worry less about stuff that's not important. You're going to figure it out with each bracket. And she's right. I mean, we still have stuff. And then, of course, the world throws stuff at us. But we begin to see things from a different perspective, I think, as we age. And, we'd love to have it in our 20s, but I don't know if we'd appreciate it then.
Agreed. It would be interesting, wouldn't it? How could we transfer it to our children? Because we obviously want to protect and love them and not give them the hard path that we did. But then would they really understand it? So maybe it can only come to us at those certain brackets, like your mom very wisely said, because we can handle it then.
Yeah.
Boy,
that sounds like a whole other podcast episode.
I know.
But what I really am looking forward to hearing you talk about today, because it's something that I am just not familiar with. And I have been through, as I mentioned before I hit record, I had been through my own pre-childbirth. I had difficulty getting pregnant because I had started perimenopause quite early. And there are things that surround trying to get pregnant, being pregnant, and then after childbirth. And you suffered a traumatic childbirth injury that really changed your body and your life forever. So I would love to have you share your experience and explain to us. You are the founder and creator and carrier of Bravemumma, and you have a podcast, the Lowdown.
That's right.
But what brought you to that? What I'd really like to have you explain. And also, I think the title of your book really says it all, which is The Day My Vagina Broke. So can you talk to us? There are other women out there that are suffering with these, and they're just trying to get through it on their own. Yeah,
absolutely. And I think similar to you, there's a backstory. So obviously from cancer treatment, there were talks of being, having fertility issues. So like you, I saw an IVF specialist to fall pregnant. It took 5 years to fall pregnant with Elsie. So it just kind of gives you a little bit of context as to when I was pregnant, I was really scared. There was a lot of fear. There was a lot of anxiety, but it's another layer that we weren't allowed to talk about. It was that women's secret business of you just get on with it. So that's basically what we tried to do. And it was a very private, intimate time for my husband and I, because we were both fearful, knowing that we weren't allowed to talk about it. So we kept it very close to our chest. What I know now, because Elsie's nearly 8, is that from the very conception, almost, that level of stress and anxiety potentially could have contributed to the reason why I had such a difficult labor and delivery. And I'll explain that a little bit further down the track. But in a nutshell, pregnancy for me, I quite enjoyed it. I'm one of those very lucky women who didn't have a lot of issues. I was diagnosed with gestational diabetes, which for me as a triathlete surprised me. I thought it was something that only potentially unhealthy people have, but it does not discriminate. You just either have it or you don't. And it's the way that your body reacts to pregnancy. So I was able to manage that with very strict diet and exercise. And I thought I was doing really well. And I wanted the perfect pregnancy and the perfect childbirth. And I wanted to be the perfect mom. And I wanted to bounce back and go back to being an athlete. I had it all planned out, Kath.
Of course, as we do.
So I think a lot of the trauma part really presents itself when your picture and the way that you had it planned doesn't work out. And your reality is very far from that. I think that's where the trauma lies, because I'm not too sure what it's like in the US, but here in Australia, there's a really strong push for natural childbirth advocacy. And I say that in parentheses, meaning vaginal childbirth. So cesarean section birth is not favored. And the model of care that women go into here in our public hospital system is with midwifery care, which means that you're not even a candidate for a cesarean section. You certainly can't choose one in a public hospital. If you want to go down that path, you need to find a private obstetrician and pay for it.
Wow, I've never heard that. Interesting.
Right? Neither did we. So we didn't even understand how our own healthcare system worked in the place where we live. So basically, the entire pregnancy was always talking about vaginal childbirth. It's going to be beautiful, organic. They taught you how to set the mood by putting on candles, finding the right playlist, having a good supply of snacks, and just when you go into the delivery suite, they turn the lights off. So it's
drugs.
No drugs.
Holy.
Right? This is what I'm saying. And I say this term, we were told and sold this method as being like the best option for you and your baby, because it's natural and women should just let their bodies do what they have to do. And, I'm a woman, hear me roar, that type of ideology. And for me, when you are told that in a very, I guess I was very, vulnerable place, of course you put your hand up for that. Of course you don't put your hand up for a traumatic or a, medical procedure, because that's not given as much, I guess, positivity.
Okay.
So the labor itself started exactly as planned. Candles on, music playlist, in the bath, no drugs, just breathing through. And even to the point where you weren't allowed to call them contractions.
Seriously?
Yep. They're called surges to meeting your baby. This was the language used.
Well, I can understand trying to create that mental strength, but okay, go ahead.
Even to the point where I just will never forget, they said, you just have to visualize your vagina opening up like a lotus flower and the baby kind of just trickling out. So I was thinking that was going to happen. And so when it didn't happen, it went from being in the bath, and I was kind of joking to my husband and saying, is this it? This is pretty easy. Wow. Like we can do anything, to that moment, going from that to having lights on, room full of 5 people, doctors, specialists, kind of legs in stirrups. And I'm like, what is going on? I had been laboring for a very long time and I was very fatigued. I remember standing and my legs just shaking. They just couldn't hold me. And asking my midwife, like, what's going on? What's happening? And her saying, nothing, you're fine. But I just, in my mind, was going,
It wasn't.
If I was fine, why are you all in here?
Mm-hmm.
Right? I didn't believe it. I then lost trust in that moment. Ultimately, Elsie was born with a cascade of interventions, including a vacuum, so suction vacuum. They tried to rotate her because she was posterior. She was coming out the wrong way. Episiotomy, so they cut from the front of the opening of my vagina through to the back, and then they used forceps delivery to get her out. And at that point, as a mum, you just want to see that baby alive.
Yeah, absolutely.
So there is no choice, and you cannot think. You absolutely cannot make an informed decision at that moment. And so it happened, and they said, okay, we just need to do some slight stitching. And she was on my chest, and I guess the moment we had pictured didn't happen. I just remember looking at her and thinking, what? Like, what are you? And what just happened? I think we were in shock.
I'm sure that would be pretty normal, I would think, in going through something like that.
Yes. And it only really when we got to look at the photos, because in the room they still are pretending like everything's normal and lovely, and someone else is taking photos for you. And there's a picture of Elsie who's on my chest, and there's obviously blood when you have a vaginal birth, but the blood was quite significant, and it wasn't from me. The suction cap had torn the skin off her scalp when it had failed. And in fact, her bones are formed. They're deformed in her scalp now because of it. And it's just, from that moment, I lost trust in everyone who was charged for caring for me. Because even when we address things that we didn't know what we were even saying, like, what's this on her head? And very dismissed. I do remember saying to the obstetrician, look at her head. Like, she's got this boggy patch. It looks like her scalp's deformed. And his reply, Kath, was, just don't let her shave her head when she's 15 because it'll look ugly.
Oh, Lord.
Who says that?
Who says that?
To a new mum who has come and paid a lot of money to see a specialist for her daughter's head, and is just told to not let her shave her head because of the appearance? Like, and basically that is, in a nutshell, it felt like they were the conversations we were having. Nothing about, oh, wow, that, I wonder how that's sitting for you, knowing that the hospital caused that to your baby and it was stuck, and all the things. Like, no one ever considered that element. So I think I want to say, and it's hard to remember because trauma does a beautiful thing. It lets you forget some things. Isn't it, within that first 2 years, it just felt like medical appointments back to back for me, for baby, trying to find out what happened, but no one was forthcoming with any information. And I was suffering, as you said in your intro. It changed my life forever because it changed my body forever. The damage caused during that labor to me, I'll try and explain it in very simple terms because I understand it now, but at the time I didn't even, some of the words, I was like, what is that? I don't even know what that is. The forceps, it's believed when they tried to use the forceps to get the baby out, any muscle that was in the way, fascia, tissue, was torn away from my pelvic bone, which resulted in that basically when you have your pelvic floor, all of your organs sit in the pelvic floor, your bladder, your bowel, and your uterus. They can no longer stay there because there's no muscle and fascia underneath, like the hammock was torn away, that they all kind of slide down the vaginal canal now. Hence why I wrote the book, The Day My Vagina Broke. Yes, it's actually my pelvic floor that broke, but that won't get attention. We know that.
Right.
It's a very deliberate thing to do, to be like, hey, this happens in childbirth. And so the organs can't stay there anymore. And gravity, as you know, when you're standing up during the day, every single day they fall down. It's very uncomfortable, painful, life-changing in the way that, at 35, I became incontinent, both urinary and fecal incontinence. Couldn't carry my baby, couldn't do all the things, couldn't even walk to my letterbox, let alone go and run a marathon or do anything in that triathlon space. I would say when someone first said to me, I think you have pelvic organ prolapse, my response was like, pro what? What is that? Like, what's a pelvic organ? And I guess it adds that layer of, you feel really stupid. Like, how do I not know this? And this is my body. I'm an educated woman. How do I not know the difference between that and that? And I think that's where the trauma comes from. You feel blindsided and a bit like, what was that? That's not what the birthing books told me. That's not what they said in birthing classes. And therefore, you feel like you've failed childbirth, number one. And number two, like you're the only person. So you recluse and you live in silence and you say nothing. So you pretend to the outside world, oh, I'm a new mom. I love this. It's amazing. But yet it's not. And it's really hard. Every day. And you feel it's hard to even have a conversation with your partner and your closest people because it's such a private and intimate part of your body that we are taught not to talk about. So we don't, right?
And my heart goes out to your husband too, because he must have felt so helpless with you going through that and him not having to, and let's face it, no control, just making sure that you were going to be safe and the baby was going to be safe. And then he probably felt just as helpless afterwards too. I just can't imagine.
It was a real mess. And probably now only from, I want to say the last couple of years or since the book was published, we've been able to talk a little bit about it, but it's taken a long time and we're only probably just scratching at the surface because it's hard to talk about something you don't even have the words for.
Yeah. And when you don't have the complete understanding yourself, it's so hard. And adding all the trauma still left over and the emotions, I can only imagine how difficult it must have been and still be for you to really discuss it thoroughly.
Yeah, even with professional help, like I've seen lots of professional support for me, not so much for him, maybe a little bit, but not about the birth. There was the lack of support systems. There just isn't any. It's all have to be here. You need to privately fund anything like that. There isn't even a birthing debrief. Afterwards, we were just told, oh, you did a great job. And we looked at each other like, huh? What? That's not a great job.
They still came to you and said, great job.
The very next morning, I remember it was my midwife's, was her boss. And she came in and she congratulated me. She gave me a hug. She gooed over the baby. Oh my God, she's so beautiful. No, I was thinking, look at her head. I'm not sure about that. And And then just said, congratulations and see you later. And I was sent home. She was sent home with pain medication because of her head, because it was probably very much in pain. But mummy, who was incontinent and in a world of pain, got nothing. I didn't even get checked.
Not even an explanation, let alone taking care of you physically.
Not one thing.
That's just, and I don't know why. I guess I'm more surprised that I would like to hope that things are different elsewhere than, but it sounds like medical care
Oof.
is not the same in many places as it used to be.
Agreed. And it was the catalyst really for writing the book and creating the community, because when I found out that I wasn't alone,
That's my
and then
next
in
question.
fact, yeah, go ahead.
No, go ahead. You're answering it.
Is that when I found out that it didn't just happen to us, and it wasn't like an anomaly, like oh, it's bad luck, it was a bad day, or it was because of the baby. When I found out that in fact it happens to so many women, it's very, very common, and women have no knowledge or power going into it. I was angry. I was so angry. I had been working in public education my whole life. So the advocacy piece of like, that's not fair, that's not okay, it grew inside me to the point like, well, do something, Stephanie. You cannot sit on this and know that this happened to you and you felt blindsided, because guess what? One day your little girl may want to have a pregnancy and a baby, and you cannot let that happen for her.
I'm amazed. So obviously I'm getting a little bit of interference, I think, at my end. I don't think it's you.
Okay.
And I'm not sure why. They might be doing some work up front. So apologies on that. We'll do a little editing.
Sure. If it freezes, we can just hold off and then keep going. That's totally fine.
Okay. So you found there are other women. I guess my question is, when you say, and now that you're really telling me, and I'm getting more of an understanding, is this, you said it's happening to many more women, but why is it happening? Is it all circumstances based on what you went through? Or is there a natural occurrence, or is this all man-made, man-caused?
I think that's a really good question. And there's multiple layers. I'll answer it the best I can from a patient voice, because I'm not a medical professional, but this is just what I've learned because I'm very passionate about understanding it. And my understanding is there's two separate things here. So the way that Elsie was delivered with forceps, vacuum, and episiotomy is very common, probably more now than ever before, because women are having babies older. This is what I've been told, because I was 35. I was actually categorized as a geriatric first-time mom. That was the term.
That's funny. Geriatric. Okay.
Geriatric. Okay, sure. Where our fascia and our tissues are much older than, say, a 20-year-old who is in the prime of labor and delivery. This is historically, right? The added complexity of having gestational diabetes. Again, this is what I was told, that if you have gestational diabetes, the babies are generally bigger than if you didn't have diabetes.
Okay.
So she was born at 4 kilos, which is what, over 10 pounds, I think.
Wow.
Yeah. So the next thing I learned along that journey is, this is a hard pill to swallow. The fact that I was an athlete probably meant that my pelvic floor going into pregnancy and childbirth had some level of dysfunction already, meaning it was potentially too tight. So when you labor and delivery, your pelvic floor and your anatomy need to stretch and move. But if you have a tight pelvic floor, it doesn't move. It's very rigid. And so it can't relax. It can't let baby down. So with every contraction, she was trying to come down, but my pelvic floor was like, nope, we're like concrete.
Is there a solution for that? If someone knows ahead, if an athlete knows she's going to get pregnant, is there exercise, yoga, something that?
Yes. There's so much I now know that you can do. You can even have a pelvic floor women's physiotherapist do it, a manual release of your pelvic floor internally to allow it to move that. The next thing, obviously also during cancer treatment, having chronic vomiting and constipation is a risk factor. So now the second element of pelvic organ prolapse, yes, while the number one cause is having a pregnancy and vaginal childbirth that puts you at potential risk, but there are many women who still have prolapse who have never had a baby.
Really?
Yeah. Or even women who have had cesarean section birth.
What is it something that happens? Because this is twofold. You said that have never had a birth. So how is it happening? But then is the happening right after the C-section has happened, or is it down the road?
It could happen at any point. So
Really?
we've got, which we now know in our community, women who are 20 years old, who have never had a pregnancy, experiencing prolapse, because the risk factors for pelvic organ prolapse include, yes, pregnancy and vaginal childbirth, but the tightness of your pelvic floor. So we do have a lot of, professional dancers, gymnasts, horse riders who have these extremely tight pelvic floors where the organs just cannot stay because there's no movement. Another risk factor is chronic constipation or vomiting as a child. So now I teach my children to not put pressure if they need to go to the bathroom. We actually teach them how to do some breath work on the toilet so that you're not straining. Diet and exercise is another element. So it is been said that if a woman is obese, the risk of prolapse because of the intra-abdominal pressure from the top causes it to fall down. It can be hereditary. So if you are a woman who have had connective tissue disorders, that can be passed down through our lineage. There's it's more than just one thing. It's almost like there's multiple layers of pelvic floor dysfunction that you can have from a very young age and not even know it because you can't feel it until it gets to, like a higher grade. There's 4 grades. So grade 1, 2, 3, and 4. A grade 1 and 2, you may never even feel it. You may never even know that your organs have descended a little bit. And generally at those 2 stages, you can reverse it, which is great with pelvic floor physiotherapy, with focusing on your lifestyle. Stage 3 and 4 is more like me when it feels very broken and the organs live in the vaginal canal and your vaginal walls have collapsed, like everything just kind of goes down. And then it's not the organs on the outside, it's actually the vaginal wall. So your organs pushing them out and then it lives on the outside. That happens to so many women. And yes, there's potential treatments, including, the use of pessaries, which is a silicone device that you can insert to try and hold it up. But for women like me who have had that damage from forceps, there's no shelf anymore. There's no shelf for the pelvic organs to sit on.
So they can't create a hammock type thing?
There are some people who are candidates for surgery. Surgery is a whole nother podcast. It really is a beast because the spaces that we're in, some women who have been lucky to have an amazing surgeon who have done a great job say, oh, I wish I did it sooner. But there also are a lot of women who said, I wish I never had this done. It's made my life more complex.
Wow.
So sometimes by stitching it back up, there's complications and issues. And then they become incontinent. And, so it's a real beast. And I had gone down the surgery path because I was like, I can't live like this. I cannot continue my life like this. Got to the point of pre-surgery testing. And it was then after that, he has said to me, I'm really sorry, but you're not a candidate for this. If I give you this surgery, there is a 93% chance that it will relapse within 2 years.
Well, kudos for him for being honest. At least you're getting some information that you weren't given before.
It was a hard drive home. He works about 2 hours away. And I just remember driving home, shoving McDonald's fries in my face, just going, oh, my life is over. This was going to be the light at the end of the tunnel, and now it's gone. And it was a hard day. But yes, I would much rather have done that than had gone through a full hysterectomy at 35 and had this surgery in it to come back anyway.
Yeah.
Mm.
That's a lot.
Yeah.
But you have another child.
I do. Yes, I do. It's still the number one question I'm asked. How did you go and have another baby with prolapse? And or why? Why did you have another baby with prolapse is probably another question. And for us, my husband and I were totally satisfied that once Elsie came into this world, that we were one and done. One baby, we had finished. That was enough trauma for a lifetime. And it was actually coming back from that surgical appointment, and I picked her up from my mum's house, and she was sitting in the window. She was only, I want to say 7 months old. And I looked at her and I'm like, oh, wow, we've never considered her in this equation for our family. Like, what if she would have loved a sibling? It never even, it wasn't even a thought for us. We were just like, no, that's it, we're done. And when I said that to my husband, he looked at me and he's like, oh yeah, we couldn't ask her. She's too young, obviously. But it just gave us a different perspective on maybe we need to think about this a little bit more. And I think ultimately we got to the point where she was turning 1. So it was October. And I said, you know what? We can't wait another 5 years, because it took 5 years to have her. I'm not having another baby at 40 because I can't live like this for that long. We said, okay, if we're not pregnant by the end of the year, that's it. We'll just call it, and then that's it. And then as the planets aligned, I was pregnant the very next month with my son, who now it's easy to look back and go, yes, it was meant to be. They are 22 months apart and extremely close as siblings.
Nice. And hopefully they always will be. That's such a beautiful thing to see them be as they grow and age and become adults and still have that friendship.
Yeah, yes, I do hope so. I hope that bubble never bursts, because right now it's beautiful. At this age, at 5 and 7, they're best mates. And both my husband and I had siblings who were much older than us. And we felt lonely, and we didn't want that for her. So I think we did the right thing, basically. And I think pregnancy with him was stressful, because I was always thinking, can I carry a baby full term with prolapse? Interestingly, though, I would really love to share.
Please.
I found a private obstetrician this time. I was like, I think naturally, when anyone experiences trauma in this part of their life, like Camp A, they'll naturally run towards the opposite.
All the way.
Yeah. So we were blessed to be able, and privileged enough to be able to source a private obstetrician and pay for the level of service and support that I needed to get me through that. There was a lot of work that went into that. And he said to me, you'll probably find that in your second trimester of your pregnancy, as you grow, as your belly grows out, your uterus and your pelvic organs will probably naturally go up, because it's just the way it works. And it did. I had great relief from prolapse symptoms for the second and third trimester, probably not towards the end. And it felt great. I was like, wow, I could just be pregnant forever.
It's so wonderful to hear that that was the case, because you got to enjoy the pregnancy.
I did.
And maybe a little less fear once you learned that.
I was still really stressed about the labor and delivery because
Yeah, that part, yes.
I was
I can
adamant
understand.
that I wanted a cesarean section birth this time. I was like, there's no way I can birth again. And again, with the help of that amazing obstetrician, he guided me through the 9 months and said, sure, we can do a cesarean section, but it could actually give you different levels of complication because we'll be cutting. And he explained what a cesarean section birth was. He said, ultimately, you've had a lot of damage to your pelvic floor. This should make it easier for baby to come out. And in my mind, I was like, well, hang on a minute. If the baby's up here in my tummy and the prolapse is down here, isn't it going to act like a plug? Isn't he going to get
That's
stuck?
what I'm picturing.
And it was a simple conversation for him to say to me, well, what we do is we empty your bladder, we'll catheterize, we'll lay you on your left-hand side. The bladder will and your organs will fall out of the way thanks to gravity. Baby will come out. And that's exactly what happened. It played out exactly how we had talked about. And I always knew in the back of my mind, if something happened, if he got stuck, or if mentally, emotionally, I was not coping, I could say, right, let's do it and have a cesarean. So I had that kind of plan A, plan B reassurance that I was actually going to be okay no matter what happened.
It's wonderful that you found this obstetrician.
He
What a blessing he was.
Oh, yeah.
Wow.
Oh, yes. I found him by accident, actually, but he was always meant to be in our life for sure.
And you're referring everyone to him now, I suppose.
100% I am. Yeah. I actually stumbled across him in the aftermath of Elsie's birth at the public hospital because he had to see me after with my complications. And then he left that hospital because of what was happening to women at that time in childbirth and started his own private practice. And then I found him, I tracked him down. I was like, I can find you.
Well, I'm so glad. Surely not as much as you and your husband are, but I'm so glad you were able to find someone like him. This is definitely, I'm going to ask you if we can do a part 2, because I think there is just so much more into this.
Yes.
But can you tell me how you feel now? How do you feel today?
I'm glad you asked that, because it's really important to let people know that even though I've had this traumatic experience, and even though I still live with pelvic organ prolapse every day, I still have been able to do so much inner work to live the most fulfilling and best life I possibly can. If anything, my reference to cancer, I was lucky to have it. I almost feel like that now too. It's taken a long time to get to this point, but I said to my husband the other day, actually last night, I'm lucky we've got this, because what it meant was simple things like yesterday. I got a call from my school, at my daughter's school, and she wasn't feeling well. And so I went down and I picked her up and I brought her home. And I said to him, had this not happened, I would be back at work full time in a location setting where I wouldn't be able to get her. I wouldn't be able to bring her home and nurture her when she was unwell. So yes, while I don't love that I lost my career after 20 years, I couldn't be a triathlete. I couldn't do my small business anymore with my best friend. What I get now is an opportunity to be with her. And because of the afternoon, my symptoms are quite intense. We laid down on the couch and watched a movie together. And that's beautiful. Yes, I'm very lucky. Right? Yes. This is that constant tap on the shoulder reminder to slow down, take it back a notch. It's like, Okay. Thank you, universe. I got you. I got the message. Okay. I got it now.
And I'll toot your horn a little bit too, because we've been in the same circle for a couple of years now.
Mm-hmm.
And so I've had some exposure and an opportunity to watch and listen and see what you're doing. And you're helping a lot of women. And I do believe you even had some recognition for that. Not that that's what you're looking for, but I just want people to understand that you're really on a mission that even though that others are going through this and it's traumatic for them, having someone like you, excuse me, who's been through and understands and knows what a support system and just energy that you have for these women. And that is just incredible.
I feel like it's my purpose now.
Agreed.
It's my honor to represent these women in a way that they are so unseen and unheard by the medical professionals, by our lack of resources and education and research into pelvic organ prolapse. I mean, women have been living with prolapse since beginning of time.
And I've never heard of it.
Right? They
Never
used to
heard of
use
it.
they used to use pomegranates and potatoes in their vagina to support their pelvic organs. And even in some countries, once women have prolapsed their organs, those women are shunned out of the community because they're no longer of use to do labor work. And so culturally, historically, this has been happening to women. And we're talking about 1 in 2 women can be affected. That's 50% of our female population. When someone says that to me, I think, how are we all not banging the drum? How are we not?
That's why I'm so now totally aware that there is so much more to this. And we haven't even begun to touch on it today. Would you be willing to come back and continue this conversation so that we can really help to educate and support more women?
I would love to. I would love to. I tell you why. For 2 reasons. One, because I think the conversation must continue. We can't just say, oh, here it is, and there's the book, and then that's it. We walk away, because nothing has changed. And second of all, because quite often, once we do a podcast or I do a live event, it is not until a week later I'll get a private message in my, Instagram that says, thank you so much. I couldn't say anything at that time, and I've told no one, but I don't feel alone anymore. And that's what we need to be letting women know and feel.
Yes.
That this is not the end of the world. Prolapse does not mean the end of who you are. And help them navigate through it, because a lot of women can reverse it. You can change it. It's not a death sentence.
And
right?
even prevent it in probably many cases.
Yes.
So those things we will get into in part 2.
I love that. I love
So
that.
I'm
Advocacy.
going to thank you so much for doing what you do, because that is the purpose of my podcast, Your Life, Your Way. It's just to support women in finding whatever they can that's right for them to live life on their terms. And this is a huge part. Our health is so much a part of it. We have to really start to focus on that. I'm speaking of myself as well. Practice what you preach. But thank you so much for being here today. And we will set a time.
Yeah.
And come back and pick this up where we left off, because it's just too important not to.
Thank you for the opportunity.
You're welcome. Thank you, Stephanie. Thank you for joining us today. And as I said, this is part 1. We will be back for part 2. Stay tuned. Please, 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 please share this episode. We need to bring women's issues more to the forefront, the issues that we are keeping quiet to ourselves about, that we are at home thinking, we're suffering alone. We don't want to bother others. We're afraid. We need to support each other more than we do. The more we talk about these things, the more we can find support and help. Please feel free to share. You may not know anyone going through pelvic prolapse. However, the more we share this, it's going to cross someone's path who is suffering. No matter what country you're in, you can reach out to Stephanie. You can find her on Instagram. I will have her information in the show notes. Reach out to her. Help her. She can help you find some information, find maybe a good path for you to find answers for yourself. Any other issues that we are at home hiding with? Let's bring them to the forefront. Let's talk about them. Let's start supporting each other in a deeper, more compassionate, empathic way. I appreciate you all. I'm so blessed and honored that you're here. I'm thrilled that you're in this community. Please take care of yourself. If you are at home feeling like you're suffering with something, please reach out to a friend, a family member, therapist, someone who can help you find your answers. Thank you so much. Peace and blessings.